Hi, my name is Linda Johnson. I'm here today to prepare a YouTube video for my MLS immunohematology class for the University of Kentucky. My topic today is emergency release of uncross-matched products. I will begin by setting the scene. At a small critical access hospital in rural USA, a busy Saturday morning, typical weekend staffing, one technologist covering all areas of the laboratory, beginning of a 12-hour shift. Typical responsibilities: routine outpatients, timed inpatient draw and testing, new patient admit labs, emergency room labs as needed. The situation: about 10 a.m., the laboratory is notified by the emergency room that they have a lab draw. The emergency department is noticeably busy when the lab tech walks in. Patient 1 is drawn and standard emergency room labs are started in the laboratory. Then the emergency room contacts the laboratory to order a cross-match and transfuse 2 units of packed red blood cells to patient 1. They say they want it now. Stat. Question: are we talking emergency release uncross-match units? The reply: yes. So at this time, the technologist has to act quickly to prepare the appropriate paperwork for the physician to sign for the uncross-match units of packed red blood cells. A quick look at the blood bank inventory shows there's only 3 O-negative units available. O-negative units are pulled from the shelf for the emergency release. Note that there is always a decreased number of available donor units in smaller rural hospitals. The inventory in the blood bank is 6 A-POS, 6 A-neg, 6 O-POS, 2 B-POS, and 3 O-neg. And at this facility, they have just recently decided to start pulling the B-POS from inventory because of the difficulty of transfusing, exchanging, or transferring these units, because the hospital ends up absorbing the cost of the units if they are not giving. On every unit of uncross-matched blood that is released, there is a red tag that has to have the patient's name, ID number, location, blood type if it's available, and then on the emergency release form that the doctor has to sign, he can either choose uncross-matched type-specific blood or uncross-matched O-negative blood. On this form also is the patient's name, hospital number, the physician, and birth date. In the meantime, emergency department notifies laboratory of second patient needing lab work. Blood is drawn and typical emergency room labs are started. The emergency room nurse signs out 2 emergency release units on patient 1. Note at this time that the type, RH, identification number are recorded in the blood bank log. Donor segments are pulled and saved for later cross-match procedure and storage for any other testing that may be needed on these units. While trying to complete the type RH cross-match on patient 1, laboratory receives a new order for a cross-match on patient 2. They also want this cross-match. Stat. Technology is informed at this time that the units previously released, the emergency released units, were giving to patient 1 and patient 2 instead of both to patient 1. Red flag. There is only 1 O-negative unit. Technologist needs to finish typing at least one of these patients to continue releasing donor units. Quick tech thinking. Blood is my product, just as prescriptions are a pharmacist. With the knowledge of the only 1 O-negative left on the shelf, the technologist decides that the next unit to be released must be type specific. Note at this time that type-specific uncross-matched blood is still an option with physician signature. Remember, any and all donor units must be cross-matched even after releasing to patient, and at any time of incompatibility is found, the physician is notified and the unit must be stopped immediately. The emergency department physician was notified of the technologist's choice, and adequate time was allotted for the workup. With this clarified and communicated that only 1 unit was administered each patient, technologist was able to perform type, RH, Coombs, and full cross-match on both patient 1 and patient 2. Patient 1 and patient 2 were administered type-specific blood. Patient 1 was stabilized and transferred by ambulance with 2A positive units packed in a standard blood bank box with ice to maintain temperature. Unfortunately, patient 1 injuries were very extensive and the patient did not survive. Patient 2 was stabilized and transferred life flight, surviving the accident. In reflection, routine laboratory duties do not stop when emergency department calls. While prioritizing the emergency labs, the technologists processed outpatient labs, performed quality controls, maintained all laboratory duties. Though the workload was great and the time was short, the technologists did not call in help. As a seasoned tech, the technologists realized that the situation would be under control and manageable by the time assistance would have arrived. But remember, anytime backup can be called in and that a pathologist is always available to answer any questions or to intervene communication with the physician if needed. What could have gone wrong? There could have been a positive antibody screen. If this was to happen, the physician would be notified immediately because this is considered a critical result and it is his choice to continue or discontinue the unit being transfused. There could have been a positive cross-match. Incompatible unit. The physician must be contacted and the unit must be stopped immediately. There could have been a transfusion reaction, but the patient still needing blood desperately. If this was the case, the unit is returned to the laboratory, transfusion reaction workup is performed, and then the physician is contacted to discuss the cause of the reaction. Additional blood units can be obtained through the American Red Cross and neighboring hospitals. Sometimes the hospital will have in place where local and state police have efforts for emergency situations like this, relay the blood units. What you need to remember, as with healthcare workplaces, the laboratory can become overwhelmed in a few minutes. With quick, precise, educated thinking, we can foresee and accordingly schedule our workload. By the time you've waited for someone to arrive, a majority of the massive task at hand could have likely been managed. However, assistance is always available. This real situation is an example of conditions that we will eventually work under. Though we pray it will not be an everyday occurrence, we learn to handle it as if it were. As we wrap up the rest of the paperwork after a hard day like this, we, after washing our hands, sometimes pat our own backs. Job well done. Thank you.